Welcome, welcome. Hi, everyone. Just going to give folks a minute to come into this main room. Hopefully you can all hear me. Can you give me a thumbs up if you can hear me? Great, thank you. Please keep yourself muted. That looks like everybody. So let's get started. Welcome, friends. Welcome to the first of two resolution hearings. For those of you that I haven't met before, my name is Andrew, and I serve the diocese as Canon to the Ordinary and Chief Operating Officer. This resolution hearing is an opportunity for you to hear very briefly from the resolution sponsors, and then to share any comments or questions you may have about the resolutions. Tonight, we'll focus on resolution number 4, urging the diocese and parishes to participate in energy usage study, and resolution number 5, affordable healthcare for social justice. We'll spend no more than 20 minutes on each resolution, so we should be done in no more than an hour, probably less than an hour. Please do keep yourself muted at all times unless called upon to speak. And if you are invited to speak, please be brief. Get right to your question or the point of your comment. The text of the resolution being discussed will be on the screen at all times so that all of us can see it and refer to it. But this does mean that I won't be able to see all of you. So when we open the floor for questions and comments, please type into the chat. You can type your question or your comment, or you can just type in, I've got something to say, something, and I will call on you in order. I think that's it. Any questions before we get started? Okay, let's start with a prayer. The Lord be with you. Let us pray. Almighty and ever-living God, source of all wisdom and understanding, be present with those who take counsel in the Episcopal Diocese of Washington for the renewal and mission of your Church. Teach us in all things to seek first your honor and glory. Guide us to perceive what is right, and grant us both the courage to pursue it and the grace to accomplish it. Through Jesus Christ, our Lord. Amen. Okay, we are going to get to the first resolution for tonight, which is resolution number 4. And I am going to turn it over to Abbot McCartney, who is the sponsor. Abbot.
Thank you, Andrew, and it's good to be with everyone this evening. I am Abbot McCartney. I'm a member of our Diocesan Creation Care Committee, and I'm also a parishioner at St. John's Church, Lafayette Square. Our Diocesan Creation Care Committee seeks to be a resource for the bishop, the diocese, and all parishes in regard to our broad environmental ministries. I want to cover 3 points this evening. 1, I want to explain the resolution. 2, I want to explain why it's worthy of your support at convention. And 3, I want to talk about implementation. Alan, can you pull up the resolution, please? The resolution seeks to encourage all parishes within the diocese to participate in a benchmarking energy usage study. What it entails, it asks for each parish to download, to collect their energy usage from their utility bills for electricity, as well as for any heating fuels that are used for each month in 2024, and to import them into a software package that's available on the web. We believe the burden is not very great. I want to say today I went on Pepco. I'm a District of Columbia member, resident. I went on the Pepco webpage, who supplies my electricity, and I was able to download 1 year of data from 2024, showing my kilowatt hour usage per month. Each parish would do that, then put that into the software package. Couple of points I want to highlight. One is that the more people that participate, the more parishes that participate, the more accurate the results will be. And those results will include a personalized report on the energy usage of the church facility that's participating, as well as recommendations on how to save on energy costs and be more energy efficient. So in regard to why it's worthy of your support, we are facing a world crisis involving the environment. And this is a step that our churches and the diocese can take to be more energy efficient. It also is a step in the right direction to address the first great commandment, which is to love God, including all God's creation. And third, it's a resolution that fits into the second great commandment, which is to love thy neighbor and to provide environmental equity to everyone, environmental justice for all. The basis is that by reducing our energy usage, in most cases, we are reducing our carbon footprint, which reduces a contributing factor to global warming. So therefore, it is a step, adopting this resolution is a step that this diocese and churches who participate can take for providing a better world for everyone here as well as around the earth. Finally, as to implementation, the burden should not be that great because the data generally is easily available. Your parish administrator or someone perhaps at the church in your creation care committees can assemble the information to input it. We as a committee are standing available to help you gather the information and to input the information as well as to interpret the results. We are working closely with environmental, with In Faith, Power, and Light, who has a long history of helping faith communities to be more energy efficient. They are acquainted with the software program that we would be using. So we're working with them. Lastly, I want to say that we are planning for February the 11th, a Tuesday evening, an educational seminar in which everyone can participate in to help guide you in collecting and inputting the data. Look forward to convention. We'll have more information in regard to how you can connect to that program. Mark your calendars for Tuesday night, February the 11th. Thanks so much for listening. Happy to answer any questions or comments. Thanks, Andrew.
Thanks, Abbott. Thanks, everyone. Alan, let's keep, by the way, everyone, Alan Fitzpatrick, Executive Assistant to the Canons, is our tech host tonight. Let's keep the resolves there so folks can see that. Now let's open the floor for questions or comments. If you have something to say, please just type into the chat and I will be happy to call on you and hopefully we can have some back and forth. Yes, Nathan Rich, do you want to unmute yourself and share your question?
Yes, hello, good evening. Yeah, so I was just wondering, it seemed like it talks about the parishes and it talks about the diocese, but I was wondering if there is any plan to have a diocese-wide report that compiles all the parishes together.
That is a good point, Nathan. That has not been on our radar screen yet, but it's certainly something we can consider because we indeed want to show that indeed the diocese is taking steps to address the issue of energy efficiency. So thank you for the idea. It's very good. Thank you.
But that is not part of this resolution right now, just to clarify.
That is not correct.
Okay.
And I see that Robin has a pretty straightforward question. Abbott, is it just data for 2024?
Yes, that is the plan. We want to be careful about the burden that's imposed upon parishes. So the idea is to get started somewhere. And if we can focus on 2024, that's the most recent year, that will serve us well, serve the diocese well.
Thank you. Pamela, I see you had a couple of comments there in the chat. Would you like to unmute yourself? I think it would be helpful if you spoke to everyone.
Thank you Reverend, I'm Pam Orrell. I'm an alternate serving on behalf of St. Andrews in College Park, Maryland. Quick question. I'm just not clear of the logistics of this because while I agree with the mission, I just don't see what the net value is going to be above what utilities can do now for the parishes, which is to just, on request, they usually will do energy audits of their commercial and faith-based and other customers. So I'm not sure what this is doing that that's not doing.
Thank you for
And
the.
maybe you can give me some clarity on that level.
Yeah, for those parishes that are already participating and we are aware of such parishes, then that's wonderful. We are trying to forward this resolution to sort of nudge those parishes that have not yet rolled up their sleeves to address the issue. Plus, there's a valuable factor here. We want to, as Nathan raised, we would like to look at the entire diocese so to permit parishes to compare results. So I think it would be valuable if as long as you're already doing the data for St. Andrews, you've already pulled
Andrews.
together the data, so you can just input in this program. We can help. We're happy to help you also input this information into this software package. So therefore, we can then compare all the churches within the Diocese of Washington.
And what will be done with that data once that comparison is done?
Obviously, you will get personalized results for your parish to help you, but then we can collectively look at the entire across the diocese.
Great. Thank you, Pamela. Thank you, Abbott. Abbott, Richard Weinberg is asking, would this study include rectories as well as church buildings proper?
Let us
Would it
consider
include
that. I think
rectories?
the idea was to focus on church buildings to sort of worship areas, but obviously including rectories would make sense. But I believe that in the study, we can identify each facility that is being reviewed. So we could do both of them. But one question is, I believe that what are the utility bills? Is there one utility bill for both the rectory as well as the worship space, or are there separate utility bills? So that's one factor, but we could certainly include rectories. That makes a lot of sense. Thank you.
Good. Okay. And just another quick question from Nathan Richwich. Do you know if any other dioceses have done something similar to this?
We do not at this point. I think if you look at the explanation for this resolution, our general conventions for the entire Episcopal Church of the United States has on 2 occasions adopted 2030 as a date that encourages parishes and dioceses to be carbon neutral. So as our committee has looked at the issue, we are trying to help parishes take the first step towards that goal. And I imagine there are other dioceses who are also trying to be proactive in helping their parishes achieve that goal. But we're not aware of, at this point, of any other diocese who's taken this step.
Thank you. Michael Mangiapane, I see you have a good comment there in the chat. Do you want to please unmute yourself and share that? And friends, if I do call on you to speak, if you would introduce yourself, your name and your parish, that would be great. Thank you. Michael.
Right. So, hi, I'm Michael Mangiapane. I currently attend St. George's Glendale, and I serve on the Diocesan Council as the representative for North Prince George's County. The question I had was, are the recommendations that are going to come back from this, are they only coming from the data that the parishes are providing from their utility bills? Or will there be other, ways to say, fine tune or get these recommendations, such as being able to do a site visit to assess energy efficiency needs and actions?
That's a good question. I think that we're starting from the fundamental point of simply getting parishes to participate in the study itself. And then obviously based on the results, hopefully we can run with it and help parishes take the next steps. That's a good point, but we're sort of starting with the fundamental point of simply getting as many parishes as possible to participate. Thanks for the question though.
Thank you both. Abbott, Linda Bailey has a question about if this resolution is passed, what happens to parishes who cannot or do not participate?
Nothing other than they will be missing the benefits of having the results. But if there's someone who doesn't feel comfortable that they have the capability of doing it, of collecting the data, please let our committee know, and we're happy to sort of step in as best we can to sort of assist you. There's no penalty for not participating. It's just that the collective good is achieved by when as many churches as possible participate.
Thank you. Donna Groves, you have a question about funding. Would you please unmute yourself? Share your
Yes.
question.
Yes, thank you. My name's Donna Groves, and I'm from St. Paul's, Baden, serving as a delegate. I was just wondering, because our buildings, especially St. Paul's, the church, is close to 300 years old. And we're, yeah, pretty close, so 250. Anyway, it's a very old building, and I think the cost for us could be prohibitive. I'm sure there's lots of recommendations. We have original windows, obviously, are very leaky, et cetera, et cetera. So I think the program and I think the resolution is a good one, but I think some of it might prove costly or too prohibitive for some churches. So would there be funding or grants for historical buildings like that?
We could address that. We're happy to work with you to sort of search the horizon to see what grants might be available. Obviously, the Episcopal Church has national grants available, but there are also local monies that may be available. I don't want to overpromise anything, but it's something we are happy to work with you on to see what grants might be available to be able to address the short changes that we see from the study. But hopefully you'll participate first of all.
Thank you. Thank you. And thank you, Sally, for your comment. St. Peter's Poolesville has installed solar panels, as have numerous other churches around the diocese, which is a really wonderful step. So thank you for that. Mick Blackistone, can you say more? You have a question there about participation, I think.
Yes, I
Did you
do. Mick Blackistone from All Saints Episcopal Parish in Oakley, Southern Maryland. We didn't participate in 2024, but can we monitor our usage in 2025 and submit it to you for your study? Our church is really historic, so we have our problems in that regard, but it has been rebuilt and it's hopefully a bit more energy responsive.
Yeah, we can obviously the point is to compare apples to apples, so therefore we want to compare 2024, but we want to work with you. I mean, it's wonderful report that you've got, that you've actually made some positive steps, but so maybe I can see a situation where your church, because of your exceptional changes in 2024, it might not work into the results for 2024, but obviously we can look forward to what's going to happen in 2025. But it's wonderful that you've been able to take some steps.
Okay, I do like the resolution very much.
Thank you.
Thanks, Mick. Thanks, Abbott. Nathan Paxton, you have a good question about sort of value added by this action. Would you please unmute yourself and say more?
Sure. My question is, it sounds like parishes can do this.
And Nathan, can you just remind us name and parish,
Oh,
please?
sorry, Nathan
Thanks.
Paxton, St. Monica and St. James on Capitol
Thank
Hill. What's the value added of this? It sounds like parishes can already download this data. So if our parish wanted to do this, we certainly can, it sounds like, especially since we're in the district and can use a PEPCO. In terms of comparing apples to apples, I don't actually understand what aggregating this up to the diocesan level provides to parishes, except perhaps another data reporting requirement to the diocesan level. So I'm curious as to what the value added of the exercise is.
Let's just say there's no requirement here. We're trying to encourage churches to participate. But it's a good question. But I think that comparison, as I understand, the more churches participate, the algorithms of the software package better calibrate the respective energy efficiencies that might be achievable by a parish. So I cannot answer your question specifically, but I think for the common good, if as many parishes participate, then your results can have a positive effect on other churches also. But we just have to get the results, and then we can address it more fully at that point. But thanks for your point.
And as a follow-up question, does the software package that you're talking about take into account any sort of I used to be a social scientist, so I want to actually make sure we're comparing apples to apples. Does the software package take into account building construction, most recent renovation, size of con, all those sorts of things that, like, to compare our parish to, I see Mother Michelle here, to St. Mark's on Capitol Hill. They're very different buildings and so forth, so they're not actually very intercomparable. So I'm kind of wondering how it'll help.
Yeah, I think we'll have to see what the results are, and maybe that will be an explanation of why some churches are more energy efficient than others. Obviously, we've got some churches that already have solar panels. But so we just have to sort of get the results and we can sort of factor that in. But it's a good point that to be apples to apples, yeah, you have different church facilities. Ages are quite different, as Mick was just mentioning in regard to his church. So we just have to get the results, and then we can sort of, working with Interfaith Power and Light, sort of come up with what the permutations are in regard to the results.
Okay, thank you.
Thank you. Joe Mims, you have a good question about parishes that maybe are doing some work or some redevelopment. Would you please unmute yourself and ask your question?
She can't. There I am. All
There
right.
you are.
Yes, hi, Joe Mims Bolden. I'm with St. Christopher's, New Carrollton, Maryland. We are planning within the next a good 4 years probably to raise our building and redevelop our site. And so I'm wondering if this particular phase of this endeavor that we're talking about, I love the idea, but would it be useful for us to participate at this time since the building is going to go away?
I would think so. At least it's a benefit to the diocese and other churches if you did participate. But I would imagine in regard to your design work and with your architect and your planners, that these results might have some impact. But obviously, I don't know how. It sounds like if you're going to raise the building, remove the building, then obviously it may not have any immediate impact in your planning of the new building. But I think perhaps it would help other parishes who are participating.
Yes, right, because our main what would you call it? One of the things that we really want to do is to make our buildings green. So that, so that we want to include in it the most recent things that are available to keep that to make it that way, so that it'll be sustainable and all of those good things that we're looking at now, and very clean energy wise. So
Thank you.
very good. So I'll keep that in mind.
Thank you.
To participate.
Thank you. Thank you. Richard Weinberg, you have a comment.
Thank you, Richard Weinberg. I'm clergy at St. Margaret's in DC. Comment that maybe is a question of clarification, but it seems to me I just want to confirm my understanding that a really compelling reason to support this resolution is the whole notion of benchmarking. So not just value to each individual parish, but as a diocese, I appreciate how the resolution starts connecting back to General Convention goals of carbon neutrality. And this is a benchmark of where are we starting between now and 2030 toward that goal. If I understand that correctly, I just wanted to give voice to that part of what the value is.
Thank you. Good point.
Thanks, Richard. Abbott, Nathan has a question. Will there be a single point of contact or a portal on the diocesan website for parishes to interact with? So I think it's a sort of a logistics question.
Yes, we can add that, but yes, because we will be adding information about this, the February 11th seminar, but yes, we will, that makes another good point. Yes.
Great. Thank you. Todd, great. I see your comment. Would you just please unmute yourself and ask your question? There's a couple of parts to it, I think. So
sure, absolutely. Thank you. Todd Thomas here, rector at St. Timothy's, DC. Full support of the values intention of the resolution. Love it. But to clarify, I'm wondering if I'm reading and hearing correctly that we're really only being asked for utility bills for 12 months to be entered into a website. There's no other data points to go along with anything. We're really just asked to enter utility bills and to agree to carbon neutrality as a goal by 2030. Is that?
Yes. It may sound to you like a low threshold, but we want to get as many churches participating as possible. So we don't want to be too onerous in regard to the requirements.
Okay. All right. Thank you.
Thanks, Todd. Thanks, Abbott. Friends, I'm watching the time, and I think it's about the point where we should go on to the second resolution, but I just want to give Abbott a last, any sort of last words, Abbott, before we move on to the next resolution?
I want to say thanks to everyone for your comments and thank you for the support, and hopefully we'll have your support at convention. So thank you so much. Look forward to more comments as appropriate.
Thank you. Thank you. So we will move on to the next resolution, resolution number 5, affordable health care for social justice. And I will invite Mark McCarthy, who is the sponsor, to introduce his resolution. Mark.
Thanks very much. My name's Mark McCarthy. I'm a parishioner here at St. Dunstan's. I've been here for the last 12 years. My wife and I were married there, and I served on the vestry several years ago, and right now I help to coordinate a social justice mission at St. Dunstan's. The resolution's got 2 parts. The first is a sort of statement of principle that the diocese endorses full funding for measures at all levels of government to provide for access to affordable, high-quality health care, especially for those who face economic and social challenges. That's the meat of it. And then there's an implementation part that says that diocese should engage in discussions with appropriate officials of the Episcopal Church, the idea being to get the Episcopal Church's lobbying group, the Office of Government Relations, to place measures for access to affordable health care among its legislative priorities. That group does a lot of good work, and unfortunately, access to affordable health care doesn't seem to be one of its legislative priorities at this point. And this would instruct the diocese to engage in conversations with them with a view towards changing that. So why is this such a good idea? We at St. Dunstan's, we had a social justice forum on healthcare inequality in the county we're in, Montgomery County. And we heard from a number of public officials about the situation in the county. Dr. Nina Ashford, who's the head of public health services for the county, addressed the group. And the county executive, Mark Elridge, did a drop-by. And we heard from representatives of the Primary Care Coalition, which is a nonprofit that organizes a network of safety net clinics in the county. And we learned a lot about the need for government programs to address health inequality. Just one example, residents in Bethesda, Chevy Chase, and Potomac have a greater length of life compared to those living in other parts of the county, Montgomery Village, Silver Spring, and Poolesville. Another example, those without health insurance in Montgomery County vary by race and ethnicity, from the highest at 19.2% of Hispanic residents without health insurance to just 2% of non-Hispanic whites. Another example, 4% of whites receive little or no prenatal care in Montgomery County, while the comparable rates are almost 12% for Blacks and for 9% for Hispanics. There's more information about this situation in Montgomery County in their 2023 Community Health Needs Assessment, which documents still other measures of inequality. For many of us, the disparities in healthcare were highlighted by the mortality rates in COVID-19. We all know that well over 1 million people died, but the age-adjusted mortality rates for whites was 315 per 100,000, which isn't great, but for Blacks, it was 493. For Hispanics, it was 513, and for Native Americans, it was 614. We all want health insurance to do the job of protecting people, but rates are increasing much faster than inflation. The average family in 2024 spent $25,000 on healthcare premiums, and that's 24% higher than that premium in 2019. And it's 52% higher than that premium in 2014. If you're looking at the healthcare plans under the Affordable Care Act, those are also increasing faster than inflation. In 2025, we're expecting the average increase for these affordable healthcare plans to be about 7%, well above the level of inflation. And this
Mark,
means
I'm gonna interrupt you and ask if you could just wrap up so we could get to some questions and comments.
Sure thing. What this means is that these disparities deprive those who are left out and left behind of the equal dignity, respect, and opportunity that's demanded by Christian conceptions of justice. This resolution addresses that level of injustice and unfairness.
Great, thank you, thank you. And I do, so Alan, I'm going to ask you, can you scroll down maybe to just show some of the explanation? I think somebody wants to see the explanation. Thank you for that. And yeah, questions or comments, please type away into the chat. Great. So let's see, Ginger, did I say that correctly? Would you like to unmute and ask your question?
It's just Ginger.
Ginger, okay, thank you.
No worries. I just wanted to know.
Ginger, could you just your name and your parish, please?
Yeah, Ginger Azare, Christ Church, Durham Parish in Nanjemoy, Maryland. Definitely a rural church, very small church. And I just wondering, what are the current legislative priorities by the Episcopal Lobbying Group? I'm sure I could look that up online, but I thought this might be faster.
Yeah, I took a look at that, but the bad news is that I didn't memorize them all. I do remember a couple of them. One has to do with racial justice. Another has to do with climate change. And there's several more. I think there's an initiative in the area of international peace.
And I think Nathan Paxton has put a link into the chat. So thank you, Nathan. That's really helpful. Appreciate that. But Nathan, I think you also had a question or a comment. I lost track of that. But if I'm right about that, please feel free to unmute yourself.
Sure. I do have a comment. So
thank you.
I pointed out and asked, how does this... So let me give my bias in that legislatively, I tend to be a little more minimalist. And so if a resolution is not necessary, I would probably not want to push it too far forward. Doing a quick once over of the church's long document on all the things that General Convention and the Executive Council have passed regarding all sorts of issues that are out there. And that was the link, I think, that Canon Walter pointed out there. But there are three that I found within that seem to cover much of the ground of this particular resolution, including one from the General Convention in 2022 that encourages Congress to enact legislation that would serve to promote equity and reduce differences in health outcomes, address implicit bias and unconscious bias, address data challenges, address the social determinants of health, and invest in healthcare professional diversity. So my question is, what does this add to what we have already directed that the national church do through the Office of Governmental Relations. And the last little thing I'll add is, based on my own time working in healthcare policy on the Hill, I don't think the church is failing to bring these things up when it meets with legislators. I certainly recall it being mentioned in some meetings. So that's where I come from.
Thank you, Nathan. Mark, want to respond?
Yeah, the Office for Government Relations, as Marion Booty just mentioned, advocates only on those issues that have been voted on by the General Convention. So this is a step in the direction of that kind of movement. I would think that what this would do is extend the role of the Episcopal Diocese of Washington beyond just the national level, but also to focus on state and local initiatives as well, where the National Lobbying Office wouldn't be directly involved. I'm happy to hear that the office is already engaged in these kind of discussions with members of Congress and the administration, but this would add the possibility of intervention at the state and local level as well.
Thank you. Thank you. And thank you, Pamela, for your comment in the chat. Appreciate that. Birgit, you have a question. Would you like to unmute yourself and share it with everyone?
Yeah, hi. My name is Birgit Mead. I'm at St. Andrews in College Park, and I am totally new to this, so I may ask naive questions here. And with the discussion, I realized I misinterpreted this request, because it says endorse funding for measures to provide access. So I think the conversation is more to lobby. The way I read this was that the church will say, we as a church provide healthcare, pay for healthcare. And that is like, well, it sounds really good, but it also sounds like something that's not feasible financially. So then the question I put in there is that for all employees of the church or all of our parishioners? But I think I misunderstood. And if I misunderstood, maybe there's some clarification of the language if we keep this to explain. We want to lobby. Okay, that's a word maybe people don't want to use, but we want to urge the government to implement what we think and we believe to be the right thing, but we are not able to pay for everybody.
Thank you.
Right. I fully agree that the language might need to be clarified there. The intent is not for the Episcopal Diocese to start paying for this kind of work. It's for advocacy, which is a better word than lobbying. So we could use that as a way
Very
to
nice. Better word. I agree.
the healthcare resolution is calling for.
Okay, thank you.
Thank you. Thank you. Michelle Morgan, want to share your comment with everyone?
A chance to talk. Thank you. My name is Michelle Morgan. I'm the rector over at St. Mark's Capitol Hill. It just seems to me that a lot of these resolutions have already been passed and discussed at length at General Convention and have directed OGR to do this work. And universal health care as a human right was passed in 2019. So I think this is great. And I think that always we need to continue to poke the powers that be to pick up the things that we've already asked for. But I wonder if, OGR's job is to lobby. That's what they do. And we may not like the word, but that's actually what we ask them to do, is to continue to poke at them and say, these actually are your duties. And as Christians, we're stepping up to say that's what it is. So it seems to me, if it's about saying to OGR, hey, remember this, or saying to General Convention, hey, remember this, that's great. But I think we pass resolutions like this. And instead, I'd rather encourage us to actually contact OGR and say, this is important to us. What can we do to help? Thank you.
Yeah, I think the thrust of it is to authorize officials from the diocese to approach the the lobbying office, and to, in light of this passing of this resolution, to say this is an important issue. We'd like you to think about moving it up on your list of priorities. The discussion that has happened so far suggests that it already should be on their list of priorities. And this would say, in effect, maybe give it a little bit more emphasis as you go forward into the next year.
And I don't think
Michelle.
I don't think it says that. And I don't know who in the diocese's job it is as an official to do the advocacy work in that, but I could be just misspeaking, and I'll shut up.
Yeah, my sense is that really is an issue for the diocese to work on. We can't specify, I don't think, at this level, who in the diocese should carry out that kind of contact role. But I think once this is passed, I think officials in the diocese would be able to pick out the right people who could make that approach.
So just to be clear, Mark, because everyone on this screen is the diocese, but I think what your intention is that perhaps someone from the bishop's staff reaches out to the appropriate officials at the Episcopal Church. Is that?
Sure. There are a number of people actually who work for the diocese or under the supervision of the bishop. And at some point, if this is passed, there would have to be a decision about who would have the responsibility for stepping forward. So it wouldn't be one of us necessarily. It would be clearly somebody who was in a position to speak for the diocese itself.
Right. And I think Nathan raises a good point, that goes back to sort of what the bishop herself said, which is, the Office of Government Relations really only advocate on those issues voted on by General Convention, right? Yeah. Okay. Thank you. Thank you, Pamela, for your question. Your question is really about whether sort of our the Office of Government Relations gets a hearing from anyone on Capitol Hill. That's what they do. As Michelle said, they lobby on behalf of us. Other questions and comments, friends?
I have a comment, Andrew.
Sure, Mick, go ahead.
Thank you. Mick Blackistone from All Saints, Oakley Parish in St. Mary's County. I can afford health coverage. I can afford Part D of Medicare. I went and got a prescription this morning, refilled, and it was $68. And I said, $68. I have Part D insurance. She said, well, that's probably because your copay hasn't been made yet, because it's the beginning of the year. If you didn't have insurance, it would have been $1,356. That's the reality of what people are facing. Now, the medicine that I refilled is not anything to do with life-threatening or anything like that. So if it's life-threatening, I think this is a real issue that I don't have a problem with the diocese getting involved in, or the government office, lobbying in favor of. Because down in the country where we are, there are a lot of people that can't afford anything. My own sister-in-law cannot afford secondary health insurance. So if she needed this medicine, it would cost her $1,350. So yes, it's gotten absurd. I think the doctors believe it's absurd. the pharmaceutical companies are absurd, and I fully support us getting involved and joining the groups of people who are trying to resolve, this disparity.
Thank you. Thank you,
Thank
Mick.
you very much.
Thank you,
Yeah.
Mick. Thank you.
Thank you.
Cheryl Peterson from Grace Church Silver Spring. I know you. Would you like to unmute yourself and share your comment?
Yeah, sure. I mean, it's not too different than what's in the comments section. We know that it's more likely we're going to be on defense in terms of preserving either Obamacare or other forms of support that exist for healthcare services, rather than, we can always ask for expansion, but I think more likely, I work for the American Nurses Association, we're on defense. So while I think it's laudable, what we're talking about here, I think more likely will be on defense.
I think you're right, but there may be opportunities to do something more affirmative than just maintain the status quo.
Thank you. Nancy, you have an interesting comment. Would you please unmute yourself and say a little more?
Certainly. This is Nancy Stockbridge, and I am a deacon at St. John's Olney. And as I'm listening to the conversation and the fact that some of this, much of the conversation refers to previous work, I am wondering if we should reconsider this resolution and submit it referencing work that has been done in the past, so that we are using our time wisely at conference, and we are at the convention, and we are referencing that we are looking at the total picture, not just one part of the issue.
Thank you. Thank you.
I think, given the discussion earlier about how previous statements have covered this issue, at least in general terms, it wouldn't be a bad idea to adjust the resolution to make reference to those. And if the group thinks that's a good idea, I could make a step in that direction to add those kind of elements to the resolution.
Thank you. And Todd, you had a couple of questions there, all wrapped into one. Would you unmute yourself? Thanks, man.
Absolutely. Todd Thomas, again, rector at St. Timothy's. Thank you, Mark, for the conversation and for the resolution. And my question was just, having not put in the time on this resolution, but would it be timely and at all helpful if we had some concrete things to mention in this, namely support for continuing with the Affordable Care Act, those whose healthcare is going to be under fire. Our trans siblings, veterans seem to be under fire a lot with their care. Women's rights in their own healthcare. I just wonder if there's some concrete things that we could say, this is, not status quo, but where we draw the line and want to move forward from with these resolutions about healthcare. Thanks.
Thanks very much for the suggestion. And it is written in a very broad way, and that was intentional, rather than mentioning specific measures like the Affordable Care Act. I do think the broadness was intended to cover measures such as actually providing care, which is what many of the safety net clinics do. It's also meant to cover making health insurance more affordable. And it's also meant to cover things like providing funding for programs such as Medicaid. I could mention those three elements in the resolution. I'm a little nervous about mentioning particular pieces of legislation, but I think making it more specific to cover at least those three areas that I mentioned might be an improvement.
Thank you. Thank you. And thank you, Nathan, for your comment as a follow-up to Todd's in the chat. Appreciate that. Andrew's question is, as a matter of procedure, may the resolution be revived at this point prior to convention? And the answer to that is yes, and I will actually say more about revising resolutions towards the end of this session. But yes, they may be revised. Let's see. Charles, you want to, Charles Hendricks, you want to unmute yourself and say a little bit more?
I hope I managed.
There you are. I've got you.
Okay. In listening to the discussion about,
Charles, just your name is Charles Hendricks. We can see that, but what parish are you from?
oh yes, I'm a delegate from St. Bartholomew's in Laytonsville, Montgomery County.
Thank you.
Thanks for reminding me.
Yeah.
Andrew. I just, in listening to the discussion about the resolutions that have been passed at General Convention, I thought that the comment that Bishop Marianne posted suggested that the resolution would, in fact, be a helpful statement for additional clarification of the position of the diocese and to work with the OGR. So that and I think she's in an excellent position to know about that much more than I certainly would. I have no objection to further clarifications of or greater specificity in the resolution, but I think the goal certainly is laudable, and we ought to be looking to pass something along these lines.
Thank you, Charles, and thank you, Robin, for your comment in the chat. Appreciate that very much. Other questions and comments, friends? We have a couple more minutes. Okay, not seeing any. Mark, any sort of final words?
Excuse me, it's Bishop
Oh,
Marianne.
Hi, Marianne.
Hi, everyone. So good to be with
Should we let the bishop speak? Okay.
Just a point of clarification about the relationship with the Office of Government Relations. It's actually quite strict that the Office of Government Relations can only speak to issues that are approved by the General Convention, which is to say that often what happens in diocesan discussions about public policy is that they get directed to the General Convention so that the General Convention can take them up, because that's where the Office of Government Relations gets its mandates. And so, but I do believe that those who have spoken earlier to say that there are resolutions in the past that have encouraged and mandated the Office for Government Relations to address issues of healthcare. But our most effective means of being specific about healthcare issues or any issue of public policy is to move them toward the General Convention, that we cannot lobby the Office for Government Relations, if that's clear. Thank you.
Thank you. Thank you. Thank you. Okay, Mark, anything, last thoughts?
So let me thank you for all the comments. I think in light of the discussion, I think somewhat clarified redraft might be appropriate. And between now and whenever the deadline is, Andrew, I'll go back and take another crack at some of these issues and be guided by the very helpful comments that I received in this discussion.
Great, thank you, thank you. Alan, I'm going to ask if you would stop sharing the screen just so I can see everyone. I do have some last words before we close out for this evening. First is a reminder that our second resolution hearing takes place 1 week from tonight. So that's Wednesday, January 15th. And we'll start at 6:30, and we will consider the first three resolutions 1 through 3, that were submitted by the Committee on Diocesan Reparations. So that's next Wednesday, the 15th. All of you will get the same emails with the links and information between now and then. Now back to Andrea's comment, resolutions can still be revised based upon what the sponsors hear at these hearings. And we will receive final drafts of resolutions and have those posted on Monday, January 20th. And we'll send out notice to everyone when those final drafts are posted. With those final drafts, we will also post an amendment form, because we will be receiving amendments to resolutions ahead of time, ahead of the Saturday of convention. The deadline for submitting written amendments ahead of time will be Thursday, January 23rd, if I have my date right, Thursday, I think it's the 23rd, at noon. Because that will give us time to just get organized before the Saturday of convention. And on the Saturday of convention, when we go to talk about resolutions, we will consider amendments submitted in advance first before going on to amendments from the floor. Okay, so hopefully that's clear, and I'll say this all again next week. Then just a reminder that on the Friday night, January 24th, that's the Friday night before the Saturday of convention, we have a service toward repentance at Washington National Cathedral. There's a dinner that begins at 5:30, and the worship service starts at 7, and the service should last no more than it should last around 90 minutes, and we strongly encourage all of you to attend. And I think the bishop will be writing to members of the diocese. I think that goes out tomorrow, so you'll receive an email from her about that. And then, of course, Saturday of convention, the business session of convention is Saturday the 25th. Doors open at 8 o'clock for registration. We'll have breakfast, opening prayers at 9, and we'll begin business at 9:15. Please remember to bring a fully charged cell phone, laptop, tablet, because you will need that to vote. That's really important. And in addition, this year we are trying to, we're sort of taking a step toward a paperless convention. And so we will not be printing out convention booklets that you've always received in the past. We're going to save a lot of trees, friends. And so we will ask that you download the convention booklet ahead of time and have that on your device. So we'll send reminders about all of this, but you'll want to download the convention booklet ahead of time. We will not have hard copies available on Saturday. I think that's it for now, but I look forward to seeing you all in 1 week, again at 6:30 p.m. for the next resolution hearing. Thank you all for being here. What great attendance. We had well over 100 people.
Andrew,
The bishop wants to say something again.
Sorry, there was a question from Jess about will the recording for next week be accessible after the fact? Andrew,
Yes, so the resolution hearings are always recorded, and they will be posted on the diocesan YouTube channel. It just takes us a couple of days to get that done because we edit it down and then get it posted. But yes, there'll be recordings available.
Thank you.
Okay. Thanks, everyone. Have a good evening. Enjoy the rest of your
So I
night.
can ask one last question? My apologies. I see you were recording this meeting too.
That's correct.
Where will that meeting be accessible?
So it takes us a couple of days to edit them,
That
and
one
then
too.
it will be posted on the diocesan YouTube channel.
All of them. Gotcha. Okay, good.
All right. Thank you, everyone.
Thank you.
Thank you. Bye.